In this module, we will be discussing adult learning theory. After watching this video, you will be able to understand key characteristics of adult learners, recognize key models of adult learning theory, and describe how adult learning theories may be integrated and applied to a practical educational scenario. Let's start the module off with a hypothetical scenario. One afternoon, you receive an email from a mentor inviting you to give a lecture to a class he or she is teaching to a group of health professions learners. You are excited for this opportunity and begin to ask the question, what would be the best way to lead the seminar? Like many of us, you may reflect on your previous educational experiences and think about ways to replicate that. Perhaps you recall a didactic presentation with slides, or maybe you recall a professor that had you do extensive reading and provided some discussion prompts in the classroom. While you may have found these experiences personally helpful, you also recognize that these strategies have their own limitations. As health professions educators, you will be leading other professionals in their educational growth and development. Before we begin to explore diverse strategies and theories of educating, let's first reflect on an important foundational question. Who are your learners? In the case example, we can begin by describing the class as consisting of adult learners. Adult learners are a unique group, particularly in comparison to child learners. Adult learning, also referred to as Andragogy, differs from child learning in several significant ways. Malcolm Knowles, an important contributor to adult learning theory, described Andragogy as the art and science of helping adults learn. In order to meet the unique needs of adult learners, he proposed several unique characteristics of these learners. With the first characteristic, the need to know, Knowles suggests that adults need to know why they need to learn something before undertaking to learn it. This speaks to the importance of clearly identifying learning objectives and goals, as this increases overall motivation and engagement. Second is the learner's self-concept. This is the idea that adults hold an increased sense of responsibility for their decisions, and recognition of autonomy in the educational setting is important. The third characteristic states that adults' life experiences are integral to the educational process, and encouraging adult learners to connect their learning to life experiences offers unique educational opportunity. Fourth, readiness to learn states that many adults are prompted to learn because of life and vocational demands. As a result, the opportunity to apply content to the needs of their career or life is considered especially relevant to the learners. The fifth characteristic is that adult learners are motivated to learn when given activities that allow the learner to apply lessons to their own specific needs. Problem-centered learning is especially valued in this context. And finally, adult learners are intrinsically motivated to learn. When presented with a learning environment exhibiting supportive conditions, this motivation will naturally grow. Shikha Kapoor expanded on this idea in an article exploring the topic of andragogy, providing several additional qualities and distinctions between adult and child learning. Some noteworthy differences include attendance, focus of content, and the roles of learner and educator. Take a moment to review these distinctions, maybe identifying ones that seem especially relevant to your current learning circumstances. Now, let's turn our attention to the topic of theory. As educators, we will be confronted with situations where we may not be certain of how to respond. The earlier scenario of being invited to lecture might be one example of this. Turning to a set of evidence-based guiding principles, as opposed to relying on what feels right, can help educators intentionally respond to the unique needs of the learners in a way that is consistent with learning objectives, overall goals, and broader educational development. Use of theory is a critical component in effective education. In the following slides, we will briefly review some noteworthy theories of education. Instrumental learning theory focuses on the individual experience and includes the influential cognitive and behavioral models of learning. Behavioral theory emphasizes how the learner responds to stimuli in his or her environment. Concepts such as reinforcement and punishment were popularized as behaviorism gained prominence. Cognitive learning theories, on the other hand, focus on how we process information. One prominent theorist from this school is Jean Piaget, who proposed that different types of knowledge are acquired over the course of childhood and adolescence. Humanistic theories approach learning from a different perspective, asserting that learners independently have the potential for self-actualization and are self-directed and internally motivated. As a result, the role of educator is to maintain optimal conditions for growth. One theory that emerged from humanistic framework is self-directed learning theory, which highlights learners' capacity to plan, conduct, and evaluate their own learning. Social theories of learning emphasize the role of context and community in the learning process. Vygotsky and social constructivism highlighted the role of community in learning and developed concepts like the zone of proximal development, which emphasizes the importance of the learner-teacher interaction in linking existing knowledge to new information. Albert Bandura and the concept of self-efficacy also gained prominence as a social model of learning. There are many other important theories of learning, including, but not limited to, transformative learning theory, motivational models, which include self-determination theory, and reflective models. If you are interested in learning more about these and other theories of adult learning, please feel free to review the references slide and relevant articles uploaded to the course website. Theory exists within a broader context of education. A good theory not only describes, but practically informs the decisions one makes in the educational environment. Theory, educational practice, and educational outcomes are all interdependent. This graph describes the process where theory informs educational decision-making, which results in additional evidence of educational outcomes, which then further informs how we use and apply theory. Can you think of a time where you may have utilized this model in your own work? Many educators choose to approach learning theory from an integrative perspective. An integrative approach results from an intentional effort to synthesize two or more models of learning. The goal of such a process is to develop a framework that will be applicable to a broader group of learners and situations. One example of this comes from David Kaufman, who synthesized principles from several theories to guide teaching practices. Integrating concepts proposed by Knowles, Vygotsky, Bandura, and others, Kaufman proposed 7 principles to provide guidance for best practices in the educational setting. These principles state, the learner should be an active contributor to the educational process. Learning should closely relate to understanding and solving real-life problems. Learners' current knowledge and experience are critical in new learning situations and need to be taken into account. Learners should be given the opportunity and support to use self-direction in their learning. Learners should be given opportunities and support for practice, accompanied by self-assessment and constructive feedback from teachers and peers. Learners should be given opportunities to reflect on their practice. And use of role models by medical educators has a major impact on learners. Now that we have had an opportunity to explore adult learning characteristics in theory, let's apply these lessons to our previously discussed example. As mentioned before, you have been invited to provide a lecture during your mentor's class for health professions learners. Using the theories and concepts described in this module, how might you develop a course session? Pause the video to take a few moments and consider some educational approaches that you might use. Let's begin by looking at Kaufman Principles 1 and 2. The learner should be an active contributor to the education process, and learning should closely relate to understanding and solving real-life problems. After reviewing these concepts, you consider some educational approaches that you might integrate. Consistent with Principle 1 and 2, you decide to have 2 points in the session where you have the learners break into smaller groups where they develop a mini presentation that highlights how the key concepts apply to their own work. Now let's look at Kaufman Principle 4, which states learners should be given the opportunity and support to use self-direction in their learning. In order to use this principle, at the conclusion of the session, you have the students identify a focus area related to their work and have them complete a small project before the end of the course. Finally, let's review Kaufman Principle 5. Learners should be given opportunities and support for practice, accompanied by self-assessment and constructive feedback from teachers and peers. In order to reflect this principle, you start your education session by asking the learners to share their previous experience with the content through a poll, with learners providing their responses by video conferencing software. For example, in this adult learning theory poll, participants were asked to share their previous experience with the content. In real time, you discuss the responses to this question and guide the group to provide ways to improve their knowledge of adult learning theory. These are just a few examples of how an educator may use theory to inform their educational practices. Are there any additional theories or strategies you would incorporate? Take a moment to consider some possible options. In summary, in order to reach our learners effectively, it is critical that we understand our audience and respond to their unique needs. The study of andragogy is one way in which we can effectively do that. Also, having a theoretical base to inform our educational practices is one way we maintain intentionality and consistency with learning objectives and outcomes. The process of incorporating theory into our work is an ongoing one, where we continue to refine our theoretical foundation as we gain experience and information about our selected educational interventions. Thank you, and we hope this video is helpful in your journey as an HPEER Fellow.